Just because I come up to Dr. Mason and say, hey, my father died of prostate cancer early, I want to be checked for that. That don't make me a punk.
Society teaches us to take care of what we have, what we possess. You take care of your house. You make sure your house is clean, spotless.
Men take better care of their cars than they take of themselves. And you can see that we take pride in our cars, make sure our car is running good, we keep our cars clean. But we don't take that same amount of effort and energy in terms of our health and our well-being.
You're not a punk just because you went to the doctor. In fact, that makes you responsible. Why? Because you're being responsible to your family, to your mother, to your sister, to your community. You're being responsible to older black men.
PELO's a South African term that stands for Rebuilding the Soul, was founded by a group of healthcare professionals and concerned African American men. Well, this is our 5th annual event. It really is focused on men and men's health.
We're just trying to create an environment where guys feel comfortable coming in to see a physician.
There's an environment that breeds ill health. That can begin to change if you change. If you decide that, you know what, I'm tired of there being a Harold's Chicken, a McDonald's, a Ribs and Bibs, and there ain't no place for me to get fresh fruits and vegetables. You pay the same amount of taxes as the folks do in Lincoln Park. Why should you not have a Whole Foods there in your neighborhood?
If you look at any major outcome related to illness and death, heart disease, cancer, stroke, diabetes, African American men are at a much greater risk than most other men of either death, illness, or disability from those diseases.
Lack of trust in the medical community, lack of trust in the doctors. This doctor may not care about me. He doesn't sound like me. He doesn't understand what I'm saying. Racism, lack of jobs within the community, unemployment or underemployment, and lack of insurance.
I would like to say to black men, don't be afraid to come out to the doctor. I mean, actually, we should all follow our wives and our girlfriends because they don't have a problem with going to the doctor.
The body is the only thing you have, and you need to take care of that. With the advancement of medicine, there's a lot of things that can be prevented.
The routine things are to get their blood pressure checked. We actually draw blood. We draw blood, we get a specimen, we send it to a lab, and from that one tube, that one vial of blood, we'll be able to tell people not only what their cholesterol is, but what their glucose is, which gives them some idea of their risk for diabetes. We'll be able to tell the men what their PSA level is, which gives them some indication of a possible risk for prostate cancer. We also do a test that really will help us. It's called the BUN and the CRE, or the creatinine test, and that will help us get some estimation of a person's risk of kidney disease. So this is a very comprehensive screening, and I think it's something that people should take advantage of when they have the opportunity. It's free, and if they actually went to a doctor to have this, they would be paying a lot of money.
I tell people all the time, the body was made to move. If it were not made to move, we would not have all these joints and tendons. What I would encourage any male to do is to just start moving, whether it be the walking and or bike riding.
Tobacco is still the #1 preventable cause of death. So if people are smoking, they should stop. If you have not started smoking, then you should never start.
But I discovered that cigarette smoking was harmful for me and not healthy. I quit. I quit. It's been more than 20 years since I've smoked a cigarette.
So I'm eating a little healthier, doing more exercise, and actually want to make sure that I'm healthy for my kids because I have 2 young sons. I have a baby girl too, so my main concern is being around for them as my father was around for me.
We're not separating black men from black women, and we understand that almost 80% of the guys that come to the clinic are because a woman brings them in, told them they had to come in, or sitting in the waiting room says you're not leaving till you get to see the doctor.
Tell those men that you really do love and care about them, and you want them to be around a long time for you and for children. And when they hear that type of encouragement and affirmation, that also pushes them forward to want to go get screened.
They're probably most likely to prevent illness and disability if they start annual checkups, screenings, taking care of their health when they're young men. I'd say between the ages of 20 and 40, because it's starting at about the age of 40 that you really begin to see problems as a result of things that people didn't do.
Kelly Jones, age 18. She wants to be a pediatrician. So you're Vice President of National Honor Society, President, Senior Girls Council, Vice President of the Senior Council, Captain of the soccer team, participated in the French Club.
This is a joyous occasion because the students who are here know that having a good education is priceless and that having a determination to succeed is a driving force in education. I truly believe that I am where I am today because of my parents, the encouragement that I received from my family and friends, and the faith that I have in Jesus Christ.
We've got Frederick Hines Jr. Now you're going into the 8th grade, you're 13 years old, and you have a grade point average of 4.0.
Thanks be to God and to the DePello Institute. My name is Frederick Hines Jr., and I am grateful to be here tonight with students who want to continue to do well in school and in life. You are being honored by the DePello Institute.
We would encourage people to take advantage of opportunities like this, and we do it every year the Saturday before Father's Day. So if they miss this year, they can always come back next year and take advantage of what we have to offer.